Sadly, there are significant numbers of children across Australia who are identified as vulnerable, and they're not just living in communities that look disadvantaged. For instance, on Queensland's idyllic Sunshine Coast, the Department of Child Safety receives up to 5,000 calls a year from people who are worried about a child's welfare. These children have life issues impacting their safety and well-being, which is repeated in regions right around our country. But this vulnerability does not always have to result in poor life outcomes. Worldwide research shows that if we put 5 specific protective factors in place, we can counteract vulnerabilities, keep kids safe, and raise the chance of good life outcomes. These 5 protective factors are cultural connectedness, health and well-being, success in education, safe and nurturing relationships, and economic stability. So let's see how this works in practice. Let's say SunnyKids receives a referral for Jacob, who's 10 years old. Jacob has a brother, Ethan, who's 7, and a mum and a dad. A couple of key points show up on the referral. There is absenteeism, inadequate food, and behavioural issues in class. We contact the family and talk to them about what's going on. We find out Dad's recently lost his job, they are struggling financially, Mum's stress levels and anxiety have increased. Ethan has been diagnosed with autism and is in a transition plan where he only attends school a few days a week. This means Mum has to stay at home and take care of him. And Jacob's literacy skills are very low. So we look at these issues and determine what protective factors can be put in place straight away to offset the vulnerabilities and alleviate some of the pressure. We immediately organise emergency relief, which puts food on the table and pays some urgent bills. We link the family to a social worker at Centrelink, cutting through the red tape and fast-tracking the process so the family has regular payments while Dad looks for work. We help Mum to access a GP and put some regular counselling in place. Because Ethan has required a lot of support, Jacob has missed out on having his needs assessed. We refer Jacob to a behavioural optometrist to look at his poor reading and behavioural issues. It turns out Jacob needs glasses, and we work with one of our partners to provide a free set of lenses. We've alleviated the immediate pressure, but there's still a lot that's not being dealt with. With Ethan's autism, the family is entitled to a carer's payment, but they've never applied, so we support them to access this. Ethan's medication has not been reviewed for 3 years, so we access a paediatrician who adjusts this. And we help Mum and Dad access some respite care on the weekends so they can have a break and start focusing on themselves. With each one of these actions, we have strategically increased the 5 protective factors. We have ensured that the family experiences cultural connectedness, health and well-being, success in education, safe and nurturing relationships, and economic stability. With the 5 protective factors in place, we have increased the likelihood of good life outcomes for Jacob and his family.